Thank you again, Dr. Sangwan, Dr. Ken, for this opportunity. And my talk is kind of continuation of what Dr. Ken mentioned in his talk. And I personally am interested in this MAC complex of disorders because unlike the inherited retinal disorders, which have some hope that we could have some treatment in future, once a MAC happens, it stays with the child for life. And it ranges from simple microphthalmos to complete anophthalmos, those with cysts, those with systemic anomalies, and they are emerging as the leading cause of childhood blindness, with the incidence varying between 1 to 15 cases per 10,000 population. Now, if we look at why this MAC happens, there are mainly two schools of thought. One is the genetic basis and other is the environmental factors. If we look at the genetic basis of MAC, there are mainly 4 classes of genes which are involved. One are the transcription factors like the SOX2, the OTX2, the FOXC3. Then there are the signaling pathways, molecules like the TGF-beta and the BMP signaling pathways. The third one, which is very interesting to me, is the retinoic acid pathway with the aldehyde dehydrogenase A13, the STRA6, the retinol acid binding receptors. And then there are some which have unknown function. Now, if you look at the environmental factors, the ones that we can really pinpoint to are the torch infections in the mothers, then maternal exposure to drugs like thalidomide, phenytoin, and carbamazepine during the first trimester. And very interestingly, maternal vitamin A deficiency has also been linked with these MAC disorders. Now, if you look closely here, there is some commonality between the genetic basis and the environmental factors, which links somehow to the vitamin A pathway. And if we see what is the retinoic acid, it is synthesized via multiple step process from the vitamin A. It is a potent morphogen and it is essential for the embryonic development. It is responsible, in fact, for the development of the normal optic vesicle and the anterior segment of the developing eye. And this is a model just showing the various genes and how they interact in the cytoplasm and the nuclear, and a mouse model where all these genes are expressed in the early embryonic development of the eye. It has also been seen that genetic defects in the retinoic acid pathway lead to very severe kind of MAC disorders. So is there a link between maternal vitamin A deficiency and MAC? And that is what came to our mind. So if we see, there is some indirect evidence like both whole globe abnormalities and maternal vitamin A deficiencies. They are actually more common in rice-dependent communities where there is a chance that there is a likelihood of poor stores of vitamin A. The second commonality is that vitamin A deficiency in mothers as well as MAC disorders both are seen in lower socioeconomic sections of the society. There is some direct evidence as well, both in animals and humans, that mothers who were known to be deficient in vitamin A have given birth to babies with severe MACs. This has happened in piglets. This has also happened in some mothers who have undergone bariatric surgery prior to their pregnancy. And some direct evidence of vitamin A supplementation, which has led to a rescue of preventing these changes in both mouse models and some anecdotal human reports. So is this enough? But there are some other direct evidence, like this is a knockout mouse model where retinaldehyde dehydrogenase type 3 was knocked out and it led to the lethal defect, and maternal retinoic acid treatment in these mouse models actually led to a rescue. Hornby et al., they actually, by seeing the commonality between maternal vitamin A deficiency and consanguinity in a southern Indian population, suggested that there could be a recessively inherited genetic predisposition to the effect of maternal vitamin A deficiency. So here, this kind of like an epigenetic or environment interaction of maternal vitamin A deficiency in a mother in a fetus who has a genetic defect in the retinoic acid pathway gene. So how did I come to this kind of interest in this part is that it started with the MAC paper of the Bodhi Consortium. And of course, Ken has mentioned that it was the largest study. What we found that around 1/3 of them were severe MAC, and the comorbidities were nystagmus and strabismus, cataract, glaucoma, and retinal detachment. But what was interesting was that we saw some regional differences in our patients. So patients with Sitapur especially, and they had, because that came with a very slow socioeconomic community, they in fact had maximum number of colobomatous microphthalmos, bilateral and anophthalmos. So in our discussion with the group, with my colleagues, with Ketki and Chintan, we had a discussion that Sitapur was also seeing a lot of vitamin A deficiency, and some part of our hospital, a Mohammadi hospital in our shop, we were also seeing vitamin A in cornea as well. So and that's how we kind of explored this association of vitamin A deficiency in MAC, and that led us to the second part of the study, which is again a very interesting finding, that what we wanted to see is it just a coincidence that these two things are coexisting, vitamin A deficiency, corneal disorders as well as MAC disorders. So we conducted a case control study now, and we recruited children who have MAC versus those who did not have MAC amongst the same population in the three institutes, and asked the mothers a questionnaire, a WHO validated questionnaire about vitamin A deficiency in their pregnancy, and we used night blindness as a marker for vitamin A deficiency. Specifically, if you have a local term like Ratondi, which is used in this part of the India, then it becomes the questionnaire becomes much more specific. So we also question ourselves, is night blindness a very good indicator of vitamin A deficiency? Why not do vitamin A levels? But in retrospect, it cannot be possible. It will be very time consuming and money consuming. And the IVACG, which is the International Vitamin A Consultative Group, as well as WHO, they both recommend maternal night blindness as a marker for vitamin A deficiency. They have said that if the maternal vitamin A deficiency is prevalent to the degree of greater than 5% in that population, and if that population, you can go and check for maternal vitamin deficiency, it will not just indicate maternal night blindness, but also correlates with the childhood vitamin A deficiency. It also, the false positive rate in such population is less than 3%, and if you use a local term like Ratondi, then it definitely increases the reliability. So moving ahead, we conducted the study, and as expected, we actually found that the maternal night blindness was around 33% in the MAC group as compared to the 3% in the control group, which was almost 10 times more common in the MAC group. And additional factors which were common, which the multivariate analysis showed, were the birth order and history of spontaneous abortions apart from parental consanguinity. And all of these factors actually are pointing towards nutrition, poor nutrition in the mothers. We also correlated the severity of MAC with maternal night blindness, and we found that the severe MAC, which was defined as bilateral anophthalmos or bilateral severe microphthalmos, the night blindness was much more common as compared to non-severe MAC. So this led us to the third part, where we are now conducting genetic studies of a 200 patient cohort of MAC patients, and especially looking at the retinoic acid pathway gene to see if the puzzle fits here, that is it really because of the retinoic acid pathway genes that these children are susceptible to maternal vitamin A deficiency, or maternal vitamin A deficiency is kind of working through some other pathways and leading to this kind of a defect. So in this study, we would be deep phenotyping all these patients, doing exome sequencing first, and if that is negative, then we'll move on to the whole genome sequencing, and also our US counterpart would be working on the zebrafish MAC models involving the retinoic acid pathway genes. At the end, I want to just conclude, why is this connection between MAC disorders and maternal vitamin A deficiency so important? Because as I mentioned before, the fault in the eye embryogenesis MAC is irreversible. So we have to look at preventive aspects. So the association of vitamin A deficiency and MAC actually provides us a scope for reducing the burden of MAC, apart from, of course, prenatal counseling and testing, and which is also very complicated in MAC because the yield of genetic tests is not very high. We need to know the causative pathogenic genetic variations in our subset of population. There are very few studies from India exploring into the genetic variations in MAC population. We also need to understand the relation between the maternal retinol levels and the MAC and its severity. All this may help us to determine the utility of vitamin A supplementation in populations where vitamin A deficiency is actually frequent. And there are pockets in India where it is frequent, and ultimately it may lead to future public health interventions to prevent MAC as a whole. So my big shout out and thank you for all the participants of the Bodhya Consortium, especially my colleagues, Dr. Chintan from SNC and Dr. Ketki from Sitapur, who have worked with me in this project, Dr. Ken and Dr. Mathur for actually planting the seeds for this consortium, which is the gold mine for all these data, and Dr. Gyan Prakash, who's my mentor in NIH, Dr. Suma Ganesh, who's my mentor in SHOF, and the team Cured, led by Dr. Sangman, and all my colleagues here, especially Ria, my genetic counselor, who is, parallelly running with me in this race. And with that, I would like you all to attend or come to this POSN edition 7th, which will be much more discussion over genetics in a workshop. And that's my time.
Thank you, Shailja, for this wonderful talk. And if there is any quick question, we can take. Otherwise, we'll go to the next talk by Abha on corneal replacement. Okay, fine. Is Dr. Benita Kumar here in the audience? No? All right. Okay, yes, yes. Go ahead.
Dr. Shailja, I have a question.
Shailja.
Hi.
She has a-
No. So this was very, very interesting. I think this is learning a lot, really. No, so you mentioned one subject with bariatric surgery.
Yes, there are 3-4 case reports after
That's
bariatric
very
surgery.
interesting, isn't it?
Mother has severe vitamin A deficiency, giving birth to neural tube defects and microphthalmos, anophthalmos kind of.
See, because clearly this is not the low socioeconomic group. It's the other extreme, isn't it?
But after
So,
bariatric surgery,
yeah,
they took
welfare,
vitamin A.
yeah.
And they have supplemented in one of the mother vitamin A with low dose, because supplementation of vitamin A during pregnancy is also risky. You can't give it in very high doses because itself it can be
Your name?
teratogenic.
No, but that is something that, the bariatric surgeons are aware of this now, because honestly, I didn't know this. So then, it's so routinely done now.
It may not be that common, maybe.
No, but it's good to keep a lookout on this, especially in the childbearing age for women. Then it's something that they need to be aware also then.
Just vitamin A, they also develop other multiple vitamin deficiencies, zinc deficiency after bariatric surgery.
So again, a neural tube. Okay.
Yeah.
Thank you.
Thank you.
very much.
That's very
Ju-
interesting.
Just one point. Maybe this is also related to the bitoid spots that we see in severe anterior segment dysgenesis. There's something that we showed. There is something to do with retinoic acid pathway in them as well, because you see this foamy kind of a discharge. It's seen in aniridia, it's seen in PTEX2 as well as PAC6. All of these, FOXC1, all of these.
Exactly, yeah. Precisely, yeah.